everyone, I'm Rachel and welcome back to Conversations with Dental Friends, the podcast for dental professionals who are ambitious about more than just clinical work. Whether you're here to grow your career, find purpose beyond the clinic, or just break away from burnout culture, you're in the right place. Today I'm joined by the brilliant Nina Farmer, a dual qualified dental therapist and nutritional therapist who built a career that goes far beyond the four walls of the surgery. We talk about how she turned a personal passion for nutrition into a professional qualification and, more importantly, into something that genuinely improves her patients' lives. Nina's also made waves in dental hygiene and dental therapy in ways that challenge the usual path. And if you're a hygienist or a therapist wondering what's possible outside the box of traditional practice, this is absolutely the one for you as well. So whether you're already in the field thinking about joining the wonderful world of dental hygiene or dental therapy, or just feeling a bit stuck and looking for that spark to do more, this episode will give you permission to think bigger. Before we dive in, just a quick favour, if you're enjoying the podcast and haven't already, please hit follow. It helps us grow, reach more incredible guests like Nina, and brings more inspiration into your week. All right, let's get into it. This is Conversations with Dental Friends, and this is my chat with Nina Farmer. This podcast is sponsored by Dura Dental, a company that's been setting the standard in dental innovation for over 80 years. Whether it's their ultra-reliable suction systems, world-class hygiene solutions, or cutting-edge dental imaging technology, Dura Dental supports dental professionals who take their craft seriously. Check them out at duradental.com because excellence starts with the tools you trust. And of course, a huge congratulations to Oratol celebrating 60 incredible years this year. Happy birthday, Oratol. Here's to many more years of innovation and excellence. I truly couldn't imagine the dental industry without you. So happy birthday from Conversations with Dental Friends. Hello, welcome Nina to Conversations with Dental Friends. What an absolute delight to have you here with us today.
Thank you for having me. Well, hello. Hello, sorry in there.
We are chatting today. We are actually having two mocktails. Thank you very much to Megagen for our podcast mocktails today. We're chatting at the ADI Team Congress in Brighton. Let's rewind a little. Nina, can you take us back to the very start? How did your journey in dentistry begin and what led you to become a dental therapist?
So firstly, I started my journey as a dental nurse. I was 19 and just done some A-levels. I wasn't really sure what I wanted to do.
Yeah.
So my auntie had been to her dental appointment and told me that her dentist was taking on, and I had been kind of thinking about dentistry very weirdly, and I was of that age where job adverts were in the back of a paper.
Yeah,
you know, and
that's what happened to me.
Yeah, little jobs in the back of the paper, and I was thinking, I quite fancy that, and I became a dental nurse. Absolutely loved it.
Yes.
And from the beginning, I kind of knew that I one day wanted to have my own patients, but I knew there was a bit of a way to go with that, lots of qualifications and things to do. But so in 2011, I went to Sheffield Dental School, and the rest is history.
The rest is history. So that was the same year that I went to dental school,
really?
2011. Who knew? And I was in Newcastle, so not too far away from Sheffield, really. Oh. So in another butterfly effect time, we could have been on the same course. Wow, well. So you qualified then, would that be 2013 whenever you qualified?
Yes,
were you
2013.
The higher education diploma?
Yes.
And then you went into practice then?
I did.
So did you stay in the Sheffield area? Or?
No, so I actually got my job off Twitter. Days. What are we still spin? I know. So I just saw this Twitter advert, and it was in Derby, and I'm from the Midlands myself. And so I actually left there last week. I worked there for 12 years.
That's right, I saw that.
Yeah. So I was able to work from my full scope from the beginning. I was asked in my interview, what scares you? And then literally that next few weeks, I saw all of that stuff, and they really helped me to grow, and that did me. So I feel really fortunate because a lot of my colleagues at the time were sometimes working at 2, 3, maybe 4 practices in order to achieve that. So I felt very fortunate that I was able to do that. And then I have just grown there for the past 12 years until last week.
I love that interview question, what scares you?
Yeah.
That was a bold question. A bold question.
Can you guess what they probably were?
Patients.
Extractions on children.
Yeah.
Because I don't know about you, but when I was studying, it was all on unconscious children in hospitals. We did.
Which is traumatising in itself.
Yeah.
I remember
but very different.
Yeah. And once I took 14 teeth out of a little girl, and she was 5, and I was traumatised for life after that. And extractions are definitely a hairier time. And then whenever we got into practice, my practice had inhalation sedation, but that wasn't on my syllabus to do that. So the dentist was coming in and doing the sedation, and that was a whole new ball game as well. So I definitely feel the fear around kids' extractions. So Nina, you're not just a dental therapist, but you're actually a qualified nutritional therapist, which is amazing. What inspired you to go down that route too, and how did that shift come about?
So I was always interested in the whole body holistic approach. To start with, I thought, look, let's just become really good at being a therapist.
Yeah.
You know, getting into my role. But I always had an added interest in it. At the time, I was seeing head of Juliet Reed. She had courses.
Fabulous. Fabulous.
So I went to see her talk. She's been doing this since the 90s. So I mean, you know, it was really inspiring to find her. I just Googled gum disease and nutrition, and she just popped up. So I just found her and found a
poster going.
Yeah. But also as well at the same time, whilst I was kind of starting to think about this, I was having some hormonal problems with myself. I wasn't getting an answer from my doctor, and they didn't seem to really know what was going on. And I just thought, you know what? I'm going to take control of my own health. I'm going to help to empower myself. I'm going to help to empower my patients. And I'm going to go and study nutrition. So that's what I did. So I did that. I did 3 years of study, and it was at weekends. So I had to cut down a day in clinic because I was very close to... I always say I was on this like wellness course, feeling worse than ever because I was just working so hard. So I managed to cut down a day a week.
Yes.
And continue that because it was a Saturday and a Sunday. Okay. Yeah. And then, of course, there were exams. Hadn't done them for a few years. Yeah. But there was also the 200 hours of clinical time where we were being observed. Can you imagine? It's quite high pressure.
Yeah.
You know, I'd kind of felt like when I went to dental school, I'd been a dental nurse for so long, and I felt like I kind of understood the world a little bit, but then I felt like a very small fish in nutrition, and I kind of had to get used to that feeling.
And how did you find someone to observe you then? Was that obviously just part of your course? Did you do a placement like we would at dental school when we maybe went out to community or something like that?
We had special weekends that were just designed on seeing clients, and we'd all do it on a rotation, and the tutors would sit in, watch everything that you said. So it was very exposure, and you know, they watched everything that you said. And we'd also have another supervisor as well, so it was quite quality controlled with these two. And then there would also be like 6 or 7 other students sitting in the room as well. So it was very high pressure.
That was a good intro into public speaking.
Yes, sure.
But that's great. And now you're working as a nutritional therapist as well as your dental therapy. How has it been bringing that nutritional element into your work and practice? What does a typical day look like for you now as a dual qualified nutritional therapist and dental therapist?
So I would say it probably doesn't look too dissimilar to everybody else, because in order to provide nutritional therapy, to block out that amount of surgery time to provide that service only it's not cost effective for a dental surgeon to sort of stop to do that. So if I do any sort of one-to-one type of nutrition, I tend to do that out of my clinic hours or on an admin day.
Okay.
However, if I've got a patient in for a hygiene appointment or periodontal disease, and I see something, I talk to them about it. You know, it sores in the corner of the mouth. We talk about B vitamins. We might talk a bit about gut health. And yes, I add in a bit more to those appointments. Okay, I don't earn lots of extra money for doing that, but it just helps me to go that little bit deeper.
Absolutely.
And if someone does have an issue, they want to go deeper, then they've got that option to book in with me with my other hat on at different times.
Yes, so you're kind of having that opening conversation really, and then you're the connect to that next nutritional therapy place, because it is such an important conversation to have in surgery, so relevant for us to talk in surgery, especially we were just talking earlier about the impact of having the correct amount of protein in somebody who's having periodontal treatment. Mind-blowing. The same whenever you're placing a dental implant. It's surgery. There will be healing involved. For that healing, you need protein, you need vitamin C, you need to think about stress generally. I'm just essentially going back through your lecture, but there are so many things that are so relevant in our day-to-day surgery setting, and I think that's actually really interesting whenever you think about it, not just as a booked out appointment, because not that I was confused, but I wasn't sure if you maybe had an appointment for an occlusal composite, and then you maybe have a nutritional therapy appointment, and then you maybe saw somebody for a periodontal assessment, and then you did the perio. So it's great that it's kind of peppered through your entire day.
It's incorporated into what I do already, and I don't see that when we're giving out generic advice and not a targeted advice, we're perfectly within our remits and scope as a dental therapist or a hygienist or a dentist. We do learn a bit of nutrition at dental school, don't we? But if we are doing anything more targeted, we need to spend that time finding out about that person's relationship with food.
Yes.
We don't want to add to any disordered eating. So the advice I always give whenever I talk about nutrition is always talk about how we can make it better and what we can add in and not take away, unless you are spending that time and you are indemnified to have those conversations.
And you would talk then, I'm sure the depth that you would achieve then would be very targeted with maybe the backing of a blood test, that kind of appointment, and then you would maybe look at specific meal plans for a patient, or if a patient had specific goals related to nutrition.
Yeah, so we'd look at goals, we'd look at anything that any complaints of, like I get really bad bloating or I need some more energy. With functional testing, we wouldn't know what we're going to do until we've done that assessment, because we don't just do it a blanket. So if someone needs a gut test, we would find out if they actually need it. Because again, if it's private, obviously there's a cost incurred. Try to work with the GPs as much as I can about what's available with the NHS as well. And we tend to only do tests on need and a holistic targeted approach, which again, we can't do within our scope of dentistry.
Yes, very good. You've clearly got a passion for learning. Can you talk us through some of those that additional training that you've done and courses that you've done along the way, maybe from a dentistry perspective?
From a dentistry perspective, yes, I've done composite courses. Yeah, so I went on Monic Masant's many years ago.
Popular one, a very popular one.
Yeah.
And it looks amazing. I haven't done it myself, but I hear very good things. I've had a few people chat to me about Monique's.
He was very inclusive dental therapist, and I remember that it was, I think it might have been 2016, so it was a little while ago, but I was the only dental therapist there, and he was very inclusive of me.
Excellent.
Very awesome.
I will leave a link to Monique's course. I've left one already countless times if you're a regular listener, but I will leave one again in our show notes.
But yeah, I've done countless webinars and day courses, and probably way too many I could reel off. And one that I did actually do last year was a diploma with the Smile Academy, and that was a diploma in clinical education, coaching and mentoring.
Yes.
So that was amazing.
And what does that entail?
So, I mean, the reason I wanted to do it is because I talk so much about my nutrition, and I wanted to prove to show that I have put that time in, to show that I can teach about it. But I also think just the coaching and the mentoring skills just really add so much value to my nutrition, but particularly my dentistry every day. It really kind of switched the way I talk to my patients in the chair. Like, tell me why you're here today, or what would you like to get out today? Open questions rather than just kind of getting straight into it. And I've noticed a really positive change in my dental surgery. So
that's brilliant. That's brilliant. I love that, and that's really interesting, because I do actually know a few people that have went on and did that course and have got so much out of it, but obviously huge investment in terms of your time. You're also taken away from your clinical diary. You often have to travel to go to the course. So would you say that's definitely been a real worthwhile thing for you as part of your practice day to day?
So on this course, you get coached and mentored the entire time as well. And you're very much out of your comfort zone, which is where the growth is, isn't it?
Yes.
So I would say over that period of time, I really grew as well with the experiences that I had there.
That's lovely. Nina, you've been making waves in the educational side of dentistry too. You've been involved with BSDHT study days, the Restore course that we were on in Belfast in August. You work with NSK and TP as well. How did those opportunities come about, and was education always something that you saw yourself stepping into eventually?
So I remember when I was at dental school, because I was the dental nurse, and they had the other half of our cohort was the sort of degree background, as it were. And I can remember always just like really wanting to teach and help those people. And they used to say to me, I can see you being a teacher one day. And I never really thought of it myself, but I used to get so much joy out of it.
Yeah. This episode is sponsored by Lighthouse Dental Company, your partner in creating beautiful functional dental practices. From equipment supply and servicing to full refurbishments, including flooring, cabinetry, electronics and plumbing, they manage the entire project so that dentists can focus on what matters first, their patients. You can explore how they bring practices to life at lighthousedentalcompany.com.
So I don't know whether I ever thought I would be able to, because it's about growing and self-belief, isn't it? But I always enjoyed it.
Yes.
With regards to how these opportunities came arise, well, I actually started an Instagram quite a few years ago when there wasn't really a lot of Instagrams going on, and people reached out to me, and it was all through networking.
Yes.
I was talking about the nutrition that I was doing, so I was posting things I think that were a little bit different, talking about my journey, and then I got contacted and connections were made, and then it kind of just all went from there and into something bigger.
Excellent. I love that, because definitely yours was one of my first hygienist therapist Instagrams that I followed, and I feel like now having an Instagram has went from something being nice to have to really being something that is a bit more ingrained in being a dental hygienist, being a dental therapist, rightly or wrongly. And there are so many good and bad things about social media, but definitely that's a real benefit whenever you can have that opportunity to contact. And it really has reframed how we think about influence and working with a brand or a company, because I think that would have mostly come maybe from an educational background, or if you were working as part of a university or a dental hospital, whereas now it's a whole new wave of people coming through social media, which I really like. You wear a lot of hats. How do you manage to juggle your clinical work, education and everything else without burning out?
Well, obviously I need to say good nutrition, right?
Good nutrition is one.
Targeted supplementation and all of that. But no, I just have, I know it sounds very cliche, but I only do things that I align with and that bring me joy.
Yes.
And I feel cheesy saying it, but it's the truth.
Yeah.
So if it brings me joy, it gives me energy. I think you can tell when something's not right for you because it takes your energy away, doesn't it?
It does. You are your own best barometer, I think, with that. And I think every time you say yes to something, you do have to say no to something else, whether that's from your own leisure time or whether that's then reflected in other opportunities that you're getting to do. So I love that you have to just listen to yourself and not say yes to everything.
But don't get me wrong, I've got it wrong a few times. It's the learning curve, and I love to learn things the hard way. It's always been the way. But yeah, it takes time and maturity, doesn't it? To be able to know when to say no.
And I think at the beginning, or whenever you're just thinking about getting into this new part of career as dental hygienists and dental therapists, this part of our roles that can open up to us outside of the clinical environment, it's hard not to say yes to everything. And I think that's probably something you've experienced as well.
Well, it's exciting, isn't it?
Yeah.
You know, people reach out to you, it's exciting, but you've got to stick to what aligns.
Yes, you've got to stick to your guns, absolutely. For anyone listening who's thinking about branching out, maybe working with a brand or stepping into education, what would your advice be?
Yeah, it's got to bring you joy. If you're passionate about it, then absolutely go for it.
Mm-hmm.
So yeah, it's just about how you feel about it.
Exactly. I love that. I think you have to be your biggest cheerleader, and not everybody is going to meet you with positivity when you say you want to start doing something like this. So you need to have that positivity from the inside. I think that's really great. Is there something about the profession, whether it's clinical or educational or even personal, that you feel people don't talk about enough?
Do you know what? I feel like everything in the world is opening up and conversations are happening more about everything. Obviously, I'm going to say I want people to be talking about more nutrition because that's my thing.
Yes.
But I do feel like they are. I feel like people are talking about it more. I think people are talking more about mental health and supporting each other. So if anything, I'm just happy to see that flourish. Flourish.
Yes, I think that is great because we try so hard all the time, and especially in this very female-dominated workforce that we're in, where we do feel there is an element of, I suppose, people pleasing or saying yes to everything. And I think now we are in a much better space to talk about mental health, to say this is not serving me, which I love. Is there a moment, Nina, in your career so far that has felt particularly special, like a proper wow, I can't believe I'm doing this moment?
Do you know, I actually love this question because it actually took me back to the day I had my dental school interview. Yeah. And I went into the toilets and looked in the mirror and I just did this like little excited dance. Yeah. I couldn't believe I was finally there. I'd done my literacy, English and maths. I'd had to do some an AS in human biology, my radiography, my oral health education. And I was finally at this point where
at the top of the mountain,
potentially I was going to be accepted as a dental therapist, which I was, which was amazing.
Yeah.
And then the first time I did a filling by myself, or the first time I saw my own hygiene patient, having these moments with you, like in a
So
podcast.
kind,
You think, wow, this is amazing. Being at ADI and talking today.
Absolutely.
I think it's just being in a sort of present way of gratitude.
I love that. I think that's so important to have that gratitude, because we're all very good at thinking about that next thing, and we don't really live in the moment when we do make the achievement. And you have to remember that the things that you're now doing were goals 4 or 5 years ago. They were like our dream scenario in those times. And yes, life changes, evolves, moves on, but you do have to be very grateful all the time and proud of yourself. I think that's something that's hard to do sometimes as a female, or generally. I think it is hard to be proud of yourself, but I think you need to take those little moments and do the happy dance in the mirror.
Yes, the happy dance. But thank you for that question, because it took me right back there.
Yeah, I think that's really, really good and really special, and it is good to be reflective. Sometimes if you think you could write a letter to yourself at the start of the experience, you wouldn't believe everything that you've been able to tick off your list, and all of those things that are still to be ticked off, I suppose. So that's really, really great. And finally, Nina, what is next for you? You've already achieved so much, but where do you see yourself heading from here?
That is a good question. So, I mean, I'm so proud of the work that I've done with my nutrition, and I want to continue with that as well. As I mentioned earlier, I have just finished my job of 12 years, and I'm starting at a new practice, and I've got myself a direct access therapy role.
That's brilliant.
And I'm going to be having my own patient list with examinations. So for me, that feels like a new challenge.
Yeah,
I'm going to have my own patient list to work with, and I'm really excited about that.
Yeah.
I've just also relocated to the area as well. So
that's exciting.
Professionally, I want to keep going on this momentum with my educational side of things, but I'm also looking forward to settling into a new location as well.
That's really great. I think whenever we think about this therapy-led role, it is kind of becoming a bit more in vogue, or we're talking about it a lot more. I think is probably the crux of it, is that we're much more comfortable putting ourselves forward in those positions, and practices are more receptive to have therapy-led roles. But it can feel a bit scary to do that. Or do you feel nervous about approaching a therapy?
Do you know what? I have been so supported by this new practice. I've gone in, I've shadowed the dentist, there's a lead therapist, there's a group of us all together, we can chat to each other.
It's nice, the community aspect.
The onboarding has been unlike anything that I've experienced. So it's been amazing how much they're embracing dental therapists.
Brilliant, brilliant. And how will that work for you then? Will you have a dentist alongside you, and then they'll just jump in throughout your exams, or do you re-refer them back to the dentist for nearly an exam part 2? What way does that work for you?
Going to be doing all my own examinations and treatment plans, and the dentist is purely going to be there for me to just double check something, or maybe refer to the, obviously if I wanted to do a whitening case, for example, we've got things in place to be able to work together in that way as well.
That's brilliant. I think that's so exciting, and I wish you every success with your new opportunity. That's wonderful. Well, Nina, thank you so much for taking the time out today from our ADI Teen Congress, which has been a brilliant event here at the Brighton Centre in Brighton. My first time in Brighton, so I have been really excited to get here. We've had an amazing programme with some amazing speakers, including Nina. And do you have any more speaking engagements coming up that anybody can touch base with?
Yeah, so I'm actually going to be speaking at Juliette Reeves' event, which again, that is another wow moment, because I went to HS Speak, asked her for some advice, and she's invited me to speak on her menopause event.
That is such a wonderful and hot topic, absolutely. So that is brilliant. We'll really look forward to seeing Nina then, and of course Nina's going to be working with NSK and TP, and I'm sure there'll be webinars and different things coming up along the line. You can follow Nina on social media. What's your Instagram, Nina?
Nina Pharma Integrated Health.
Nina Pharma Integrated Health, and you can find Nina there, catch up with Nina. I'm sure she would be so happy to answer any questions that you might have via DM there as well. Nina's always been very helpful to me, so I really appreciate that, and thank you so much for coming on. Dream come true, and we will see you again soon.
Thank you so much for having me, and in the spirit of nutrition, we're off to get our vitamin D levels checked out.
We're actually going to do a vitamin D test with Mega Jen, so we can't wait for that, and we're nervous. No, we're not. Thank you, thanks. What a fantastic episode. I honestly feel like I've come away with a whole new perspective on nutrition and what nutritional therapy could bring to our day-to-day work and practice. Side note, if anyone was wondering, apparently my vitamin D level was 6.5. Not ideal when the target is 75. Basically, I was borderline Victorian child, but don't panic. I'm now supplementing. The rickets risk has passed, so massive win. Huge thank you to Nina and the lovely team at MegaGen for taking such good care of Nina and I at the ADI Team Congress and for the mocktails, which were frankly delicious. What really stayed with me from this conversation, though, was what Nina said about gratitude. Not just thinking about where we're headed, but taking a moment to really see how far we've come. It's just such a powerful reminder to try and do that as often as we can. If you're curious about nutritional therapy, I've dropped some links in the show notes, including where to learn more and how you can get started weaving it into conversations with your patients. You can also find more from Nina over on Instagram at nina.integratedhealth. Definitely worth a follow if you're into dental hygiene, dental therapy, or of course nutritional therapy. Nina has some brilliant speaking events coming up too, so keep an eye out. As always, I've popped all the highlights, links and fave moments from today's chat below in the show notes. You can follow the podcast at Conversations with Dental Friends and you'll find me at Homegirl Hygienist. Come say hi, send us your thoughts and let me know what stuck out for you from this one. And if you enjoyed this episode, like, rate, review, follow, just all the things. It really helps us keep these conversations going and reach more brilliant people in the dental world and beyond. Thanks so much for listening, take care and I'll see you same time next week.